Good morning. Hi, Brittany. Hi, Caitlin.
Hi, good morning.
Good morning. How are you guys?
Fine.
Great. Okay, so it's only the two of you. So do you mind turning your cameras on?
Oh, no, I don't mind. Hold on 1 second.
Okay.
I was trying to get positioned good. Hold on 1 second. I'm sorry.
No problem at all. Thanks you guys for coming. Appreciate it.
I'm trying to attend a lot of them, actually.
Yeah, I saw your name, Brittany, on a couple of the other reviews. Hi, Caitlin.
I'm not sure.
So everybody does their reviews differently. Some use PowerPoint, some use Kahoots. I do my reviews from the study guide. Okay, so we're going to be reviewing the Exam 3 study guide.
Oh,
If you guys want to pull that out.
Let me get that out right now.
Okay.
Yes, give me 1 second. Grab that.
Okay. I'm going to share my screen and pull up the study guide. You guys see that? Have you had a chance to look at the study guide yet?
Yes.
Okay.
Sometimes it just doesn't match what the teachers are doing, so I've had time to look at it, but of course, it doesn't match. Sometimes it doesn't.
So let me give you, so our study guides are formulated by several things. They're formulated by lectures, weekly lectures. They're formulated by content review, PowerPoints, readings, assignments, case studies. Okay, so the study guide is a summation of all the content that we've covered. Okay, so Brittany, it should match pretty closely with what you're learning in class.
No, not the class. I just meant the reviews. That's all. Not the class. No, ma'am.
Oh, okay. All right.
Sorry.
So, no. So there's quite a bit of chapters to be covered in this exam. However, as I tell my students, if you go through and read the objectives in each of the chapters you're responsible for, if you're able to articulate the objectives, you should do well on the exam, because we also do the exams based on the information from the objectives in each chapter. Does that make sense? So as I tell my group, don't feel like you need to read every chapter from start to finish. Please go and look at the chapter objectives and then go to those areas of the chapter and read those areas. Okay, because the objectives of the chapter are the most important things to know. Make sense?
Yes.
And you should see quite a bit of the answers to the objectives in this study guide.
Okay.
Okay. So we'll go through the study guide. I'm not going to go through it word for word, but kind of show you how to break down the study guide. And then we can do some test taking strategies. All right. So, well, thanks for coming. Appreciate it. Again, at the top here is the chapters that are going to be covered. Same number of questions, same time limit. At the end of this particular study guide, there's some math conversions. Okay, I don't know if you noticed that, but that's on the back page. All right, how to set up infusion time, how to calculate doses. I don't know about I sent my students, there's a good training that one of our pediatric professors does on her YouTube. It's dosage calculations, and it has a couple of handouts that go with it. I sent my students that. I don't know if your instructors have sent you that, but if you struggle with math, it's a really good, easy tutorial for simple math. and simple equation setup. So if you don't have that, please ask your instructor for that. It's the math tutoring from Professor Bogart. Okay. So general questions, IV calculations for math, IV calculations, determining equivalents and conversions, oral and parenteral medication, medication for kids. And you should have all received math resources at the beginning of the term. I would suggest you go back and read through those if you struggle with math. Okay. There's some pretty simple calculation forms, kind of cheat sheets for math. Okay. And then, as we talked about, case study applications of concepts. You should be doing case studies in your classes. Assessment and prioritization. All right. Management of care. So think ADPI. Everything we do in community is also ADPI, but you need to be able to take your ADPI for, say, a patient on your med surg floor. How do you do your ADPI with that patient and then transfer that ADPI into the community? Let's say that patient goes home. How do you complete your nursing process in the home setting? Okay, so ADPI is still fully applicable. We use our nursing process in every area of nursing. Okay, always remember safety first, right? Your ABCs. Remember priority. There's a lot of questions that are considered priority questions that have, what would be some words that you would be looking for in a question?
Like, who would you go see first? Mm-hmm. I always say that.
What is the initial? What is the best? What is the last? What is the most important? What is the greatest? Okay, so make sure you're reading the questions, and we'll go through that at the end. Definitely know your prevention levels, your primary, secondary, tertiary. You should have a good handle on those by now. Okay. I would encourage you to go back and read if you're struggling with prevention levels, go back and read the chapters. Go back to the chapters that are covered on this exam, find the little box of primary, secondary, tertiary for each chapter, because it lays out examples of primary, secondary, and tertiary for whatever topic's being covered. So if we're covering environmental assessment, whatever that chapter is, there's a box of primary, secondary, tertiary examples of environmental assessment. So if you're struggling with those levels, go back and read just those boxes, and you'll just get more examples and more reading of examples of each of those 3 levels. Okay, and then we talked about the nursing process, which is your ADPI. You have to be able to apply your ADPI to each of the chapters that you're reviewing. Okay, so how do you apply ADPI to occupational health? How do you apply ADPI to school nursing? Okay, the assessment part in school nursing looks a lot different than the assessment part in occupational health in the work setting. Make sense?
Yes.
So you have to be able to apply your ADPI to all these different settings we're talking about that are in the community. And then I would also have a look at your Healthy People 2030 objectives for each chapter. Those are good flashcards. There are 20 people, 20, 30 questions on the exam. All right. So what we're looking at is, what are the objectives? Each chapter has maybe 3 to 5 objectives. So just have an idea of what the objectives are for each of those topics. And they're pretty, it's not so much memorization, but it's pretty common sense. For example, there's a Healthy People 2020 box in one of the chapters that talks about access to healthcare. Okay. Just think about what Healthy People 2030 is. It's a roadmap for health in our communities, right? So if you haven't memorized all those 20, 30 objectives, just use your common sense. So if the objective is towards health, access to healthcare, and one of the objectives set and one of their goals say, increase the number of families who have insurance. Well, of course that's going to apply, right? If you increase the access to health insurance, you're going to increase the access to care. So again, it's not so much a memorization, but now we're applying our knowledge to practice. Okay, that's what community is. Applying our knowledge we've learned in all of our classes. You guys are at the end here. So we're bringing all of our tools in our toolbox, all of our classes into community. I mean, who do we think takes care of all the ill people in the community? The nurses, community nurses, public health nurses, right? That care gets shifted right from the inpatient setting, whether that inpatient setting's a hospital, a long-term care facility, assisted living, a rehab center, drug rehabilitation center. All those people need care in the community, right? So that's why we think about putting our nursing process in place in the community. Okay. So here we say help best practice to prepare, review readings, projects, discussion, lecture, attend a review session, what you're doing now. I always tell students that start with your study guide. All right, your study guide is an excellent roadmap to what you're expected to know for the exam. If you get to portions of your study guide that you don't understand, or you think, I remember they covered that, but even after reading the study guide, I just don't have a good understanding of it, go back to that chapter and read that section. Okay? Go back to that week of lecture. Hop on the lecture and go find that area that was covered. But what I tell students is if you have a good understanding of the study guide, you're going to do great on the exam. Okay? We're not giving you the answers or anything like that in the study guide. We're identifying the concepts that were talked about in the last 3 weeks, breaking down the important information about those concepts. So the study guide is not designed for you to memorize it. We now want to put this information into clinical practice. Remember, that's what Next Gen is all about. Taking your critical knowledge and making appropriate clinical judgments. And the exam is about scenarios in the clinical setting. They're not case studies or anything like that, but it's asking you to take your knowledge and apply it to practice. Right?
Yes.
Okay. So one of the topics we covered over the last 3 weeks was community assessment and evaluation. Let's say you are a new nurse, let's say you're a nurse, you're moving to a new state because you got the job of being the community health nurse in this community that you know nothing about. You've never been to the state, you've never been to the community, you have absolutely no idea what's going on. You've been asked by the leaders in the community to do a community assessment. How do you do that? How do we go out from ground zero and do a community assessment? Okay.
I'll talk to teachers, social workers.
Mm-hmm. Mm-hmm. I mean, how do you assess the health in a community? Yep. Part of what you just said is bringing in who's your team? Who do you need help from? You probably need help from law enforcement. Find out what the crime numbers are. Gang activity, violence, the level of violence in the community. Maybe you need the school leaders. What do the schools look like? How many schools are there? What are the issues in the schools? Are the kids healthy or are the kids not healthy? Maybe bringing social work. What's the demographics of the community? Right? So you have to be able to do, instead of doing your patient assessment on the med-surg floor, you have to be able to open up your minds and do a whole community assessment. So in this first bullet, we know that community refers to dimensions of place, people, and function. What does that mean? Okay. So I like to highlight the important, what I think is the important question and the important information in the question. We know that community refers to people, places, and function. What are those three? Well, it tells you right here. So when measuring the dimension of people, where are we going to get the information? I like to highlight. So here's your dimension of people. How do you get information about your dimension of people? Well, you would access data sources, maybe from census, tourists, civic groups, churches. Okay. How do we look? What do we look at when we try and find out the community's function? Well, we're going to look at libraries, police stations, welfare agencies, state departments would be good places to get that data. And then how are we going to get data with regards to place, dimension of place? Maps, newspapers, local housing. Okay, so what kind of question might you get with regards to this first bullet? What is it asking you about? What kind of question might you get? This is how I want you to break down the study guide. You take each bullet, we see what information is provided and what kind of question might be asked about it. So with this first one, what do you think? I can think of a couple of things.
How would a community nurse access data about school illnesses?
Mm-hmm.
Who would be the resource for the community nurse?
Great. How about when you're doing your community assessment, there are 3 dimensions that are looked at. What are those dimensions? Place, people, function. Maybe you're given a scenario that you're getting information from libraries and police stations. What dimension are you looking at? You're looking at the function. Get where I'm going with this?
Mm-hmm.
Okay. So next bullet, when completing a, and we're not going to go through every single bullet. I'm just showing you how to break this down. Okay. When completing a community assessment, the nurse will include community systems categories. That to me is the important topic here. Okay, so the nurse is going to include her community system categories found within a community. What are they? There's 5 of them. They include politics, education, recreation, economics, and religion. So all communities are made up of these 5 categories, system categories or categories, right? Every community has politics, education, some kind of recreation, economic function, religion. So maybe you're asked a question about how many systems categories are there for community? 5. What are they? Here they are. This may all look different. This will look different in different communities. The politics of one community may look very different from another community. The education may look very different from one community to the other. Religion may look different from one community to the other. But what you need to know is that the community is made up of these 5 systems. Okay. Okay. The next is active versus partner Active versus partner. Oh my gosh, I can't talk this morning. Active versus passive partnerships. Why are partnerships important to a community? Think about your own community. Are there lots of businesses and corporations, groups that contribute to the healthy functioning of your community? Sure, there are. So what's the difference between an active and a passive?
Passive, you hand off the job to someone else or the work to someone else. And then
Okay.
active, you're actively involved, actively doing something.
Mm-hmm. That's exactly right. So in an active partnership, you're actually walking the walk. You're out there doing it. The example we give is a business providing healthy snacks, healthy meals in schools or after school programs. They're having a direct impact right now, right here. Where passive, maybe, let's say, maybe it's a committee to decide on building a recreation center or building a new park. Okay. That's the difference. The walking the walk, planning, one group, the passive are the plan, they're planning for improvements in the community, which bring together a lot of people. Active is you're actually doing something. Okay, and here's your examples. Example of an active partnership, low-cost snacks to after-school programs. Okay, you're walking the walk. And a passive partnership would be a city creating a new park, hospital, vaccination clinic, rec center, offering cooking classes. Okay, that's something in the works, but it's being planned, but it's kind of being planned behind the scenes. Does that make sense? Okay.
So instead of thinking of it as passing it off, we should say planning.
I
Not
would
necessarily.
say active, I don't know, walking the walk. You're in there doing the daily, making a difference daily. I mean, these kids getting low cost, healthy snacks is in there doing it, active, it's happening. Passive, you're more in the planning stages, but you're planning for better outcomes in the community, however that looks.
Okay.
Okay. Next one, during a community assessment, the nurse will perform data gathering and data generation. So there's two words. So this paragraph is probably telling you what the difference between data gathering is and data generation, right? And it's pretty simple. If you have to generate the data, this is the way I remember it. If you have to generate the data, that means the data doesn't exist, right? You have to generate it. Okay. How do you get data that's, yeah, how do you get that kind of data? Well, that's through interactions with the community, talking with people in the community. It's identifying data that does not exist. So maybe talking with people about the values, the beliefs of the community, what's going well, what's not going well. So some examples of data generation, which you're trying to generate data, communities, values, beliefs, and social norms, right? You're trying to generate data that you don't have. Data gathering is collecting information that already exists. Okay, so it's gathering versus generation. Gathering, gather it all up. You already have it. What might you be looking for? Well, maybe the age of residents, racial distribution, health organizations. That information already exists. Make sense? And then we always talk about doing a windshield survey in community nursing. What's a windshield survey?
When you drive through, drive around, kind of collect information.
Uh-huh. Yep. Yep. So it's exactly what it says. It's a windshield survey. You're driving around looking out your window, or you're walking around looking around, or you're on a bike, or you're on a bus, or you're in your car. Okay. And you're trying to do a community assessment. What's the most important thing you need to find out first before you do a windshield survey? You have to establish the boundaries, right? You don't want to be driving into the next community doing your assessment. You need to know what the boundaries are. And that's what this says. To conduct a windshield survey, the nurse will need to understand the community's boundaries to ensure that the community is adequately observed. Okay, some of the things we can observe during a windshield survey, this is just a few: population size, socioeconomic qualities, governmental structures. Does it have a rec center? Does it have parks? Are the roads clean? Are the roads in bad shape to drive in? Do people live in close quarters? Is there a crime issue? Do people out walking their dogs? Are there a lot of local businesses? Are people out and about, or no? Okay, that's what a windshield survey does. Okay. So these are the main points that you need to understand, not memorize, but just understand of how we get to do, how we perform our community assessment. These are your most important points. Okay. Evidence-based practice. What's evidence-based practice? That's part of our nursing profession. What's evidence-based practice?
It improves, it helps to improve like things for the nurses as well as like our patients' outcome while they're involved in our care.
It's evidence-based. So where's it coming from? I mean, think of how we used to care for a stroke patient 20 years ago versus how we care for a stroke patient now. Think of how we used to care for a patient who's had a triple bypass 20 years ago versus now. How have we improved our care, our processes, our technology, our medications? That's all through evidence-based practice. Evidence-based. Right? So through research, through clinical trials, through journals, through experts, right? Does that make sense? I mean, it certainly represents a cultural change in practice. Does anybody work with anybody that says, no, you know what, we'll just do it the same way we've always been doing it, and it works, right? Does anybody work with somebody like that?
Work with a
Okay.
lot of nurses like that right now.
Yeah, it's a cultural shift of bringing the best information forward to improve the care. All right. So evidence-based practice, we know, represents a cultural change. Okay. It provides an environment to both improve nursing practice and outcomes. I mean, if you've worked in an institution for a number of years, you could probably see things evolving or the way we're caring for patients changing, right? So one of the first steps toward implementing or being on board with evidence-based practice is knowing, how do you feel about your own practice? And accepting evidence-based practice as, yes, I will step up and change my behavior, change my practice based on the new evidence, the best evidence that will lead to improved outcomes. Believe it or not, that's a huge barrier. Those are the people you meet that say, no, I'm good. We've been doing this way for 30 years. It's fine. Okay, there has to be a shift in thinking. A lot of people have a lot of trouble with that, right? A lot of people have a lot of trouble embracing new practice guidelines, right? So we talked about knowledge of research, current evidence, practice characteristics. So lots of things are based, lots of things to be considered in evidence-based practice. But we as nurses need to be moving towards being open-minded about changing the current practice or current practices based on new evidence. Okay. One of the big problems is that people see there's only one acceptable outcome. Okay. So, and certainly clients and patients, right? They expect that they're being cared for with the most current, recent, proper practice, right? That their doctors, their nurses have the most current information. Okay. So evidence-based practice is super important in our profession. Disasters. Nurses are expected to participate in every part of the disaster. Preparation, preparedness, response, and recovery. We're just expected to jump in and help at any of those phases. Okay, we know there's two types of disasters, right? There's natural or man-made. Please be able to give an example of each of those. And that's the rest of this bullet. Natural, earthquakes, hurricanes, communicable disease epidemics. Those are natural. COVID, man-made disasters, something that we create, pollution, warfare, fires, water supply contamination. So you have to be able to distinguish between those two. Here, it's asking you or telling you what the Healthy People 2030 objectives for disease. What are the Healthy People 2030 objectives for disaster management? Okay, so I would highly suggest you go back to the disaster management chapter and review the Healthy People 2030 objectives. They're geared towards disease mitigation. Okay, and it goes to what these objectives are here. Read these here first. If you need some more understanding, go back to that chapter and look at the box. Okay, what are they focused on with regards to disease mitigation? Preparing, alerting, and caring for a disaster within the population. That's their main objective. Preparing, alerting, and caring. Okay, and then it goes through what objective focuses on increasing the proportion of crisis and emergency risk messaging. So it's about alerting, messaging, communication, home safety, safe driving during a disaster. Okay, so go back and read through Healthy People 2030 for that chapter. What's the definition of virulence? And we're talking about disasters here. Virulence is the ability to produce a severe pathological reaction. Okay. When teaching a family, this is in our preparedness phase. When teaching a family how to prepare for a disaster, you want to teach them how to put together a disaster kit. What needs to be in that?
Flashlights, dry foods, batteries,
Okay.
blankets.
Here's, okay, I'm going to be more specific. Food for 3 days. Review the kit every 6 months. Ensure all members know where the kit is located and learn how to turn off the utilities. Okay, that's the 4 main things, 4 main teaching points when you're teaching a family how to prepare a kit for a disaster. There's lots of other things, but for purposes of this chapter, these are the 4 teaching points we're going to teach them. Food for 3 days, review the kit every 6 months, make sure everybody knows where it's located, and then make sure everybody knows how to turn off utilities if you need to. Why do we review the kit every 6 months?
So you don't get sick by eating bad foods.
Right. Make sure there are no expired items. right? What's the purpose of a mass casualty exercise? What are we looking for?
How to
Right
stay
here.
safe when probably like there's like a Category 5 hurricane or there's like a big magnitude earthquake. So that like, okay, this is what's happening. If something like this happens, this is what you do. These are the steps that you take in order to stay safe.
Right. So it's preparedness, right? So thank you for that. So one of the other purposes of mass casualty exercises is to evaluate the agency's response and capabilities. After doing a mass casualty, a community may find that they did a terrible job or they did an excellent job. So that's why you do those exercises, to see if you're prepared. What's the response? Did the command center get set up in a timely manner? Right? So the outcome is to evaluate the time it took for EMS to be activated. That's right. Early response systems can decrease casualties while increasing availability of resources. So you need to have an idea of why you would do a mass casualty exercise. How are you going to respond if you get a Cat 5 hurricane? All right. And then we know that FEMA responds to disasters. They are kind of the overarching agency that coordinates everything when you have disasters. But I also want you to know about the federal emergency, another more specific response agency is the National Response Framework right here. Okay. They're part of FEMA. Okay. But they are brought in to provide more specific needs to the community. So FEMA is kind of like your command center. Well, the NRF is an agency that FEMA will send. Okay. And I need you to know about the NRF. What is the role of the NRF? Okay. They do 5 things. They help with transportation, temporary housing. It's right here. I'm highlighting it right now. Okay. So the NRF is specifically responsible for helping with transportation, temporary housing, medical resources, search and rescue, and firefighting. So what question might you get asked about that? Maybe what agency? Go ahead. Go ahead, Brittany.
I just was saying, what are the 5 roles of NRF?
That could be a question. Or we know that FEMA responds to disasters. What other agency might FEMA deploy into a community to help with transportation, temporary housing, medical resources, search and rescue, firefighting? Well, you know it's going to be the National Response Framework. Okay. Economic influences in healthcare. So what are the primary prevention strategies? I don't know why I don't have this. I'm usually pretty organized about all this. Primary prevention strategy aimed at economic issues. The nurse could be working with insurance companies. Right? So that could be one of our roles, to help provide the necessary coverage. Right? We're trying to shift from a reactionary acute care orientation where we're trying to be proactive. Right? So if we can be proactive, maybe we can save some money. For example, maybe somebody's been diagnosed with a rare disease and it requires this very expensive medication and the insurance won't cover it. Well, but maybe you can work with the insurance company to say, listen, it's going to be cheaper to pay for this medication, even though it's not covered, because of the care this client is going to need if they don't get the medication. Does that make sense? So economic influences simply, there's lots of economic influences, but we're talking about how could the nurses play a part in reducing the cost of care. That's one example. Make sense? Okay, so using health information, how do we help our clients? Okay, so we're developing a community-based education program. We're the community health nurse and we're doing some education. What is the first thing you need to determine before you can put together your education program?
What level of education does that patient have? How will they
Nope,
be able to understand it?
that's down the road. I just highlighted it. You got to figure out your population. Who are you teaching? Right? Population is first. And then you go through your ad pie. What issues need education? Okay. Then there's a couple of things that you're going to have to consider. Okay. So first you determine the population, then you identify the issue. Okay. But it continues. You need to select two more things. You need to select a learning theory to be your framework for your education. And you need to select some teaching strategies. Okay, so there's a lot in here. First, we have to determine the population, then we have to determine the issue. Then we have to determine what our theory is and our strategy is going to be. So your next bullet is about your theories. Learning is examined through 3 different domains: cognitive, affective, and psychomotor. Okay. Cognitive is your thinking, your memory, your understanding, your reasoning. And this is right in here. Affective is your feelings, exploring your feelings, changing your values. And then psychomotor is the skill, the hands-on. So those are your 3 different domains of learning. The next bullet addresses teaching, teach-back method. When teaching a client, the nurse should use the teach-back method to evaluate what was effective. Right? And let's see. And then the rest of this paragraph goes through why the teach-back method is important. Right? We want to have the client restate or demonstrate what was taught. We want to have them articulate what we just went over with them. Make sure they know how to use their glucometer. Make sure they know how to change their wound correctly. Make sure they know how to put their medication in the right slots each day. Here's when designing an educational program. There's lots of things that we need to consider. And that's in this paragraph here. What's the message? Keep the content to a limited number of points to avoid overwhelming a learner. Use an active voice when presenting content, handouts or posters. Right? Think about it. What if you're educating a group who's hearing impaired? What if you're educating a group who's visually impaired? What if you're working with a client that's aphasic? So lots of different things to think about when developing an educational program. Then this last paragraph here is about different generations and how they learn. So we know that adult learners all have different preferred methods of learning based on their generational characteristics. So be able to determine how Generation X learns. They're self-directed and like to work in teams. And then you have the internet generation. What do they prefer? They want digital methods, web-based, everything is on the web, virtual. And then the third one you have is the baby boomer. That's me. I just wanted somebody to teach me. I'm old school. Okay, so know the three different preferred adult learners and know what their style is. Okay. In this section of government law and policy activism, here's where we talk about malpractice. Okay, 3 conditions need to be met before malpractice can be. Liability concerns exist when the following 3 conditions are met. You had the duty to provide reasonable care. You breached that duty through an act or an omission to act. Forgot to give a medication, gave too much medication. The act or omission caused injury or damage to the client. Those are the 3 conditions that need to be met to prove malpractice. And we mentioned case managers here. That's the section this comes from, but this isn't just case managers. Okay, this is nurses. In fact, I should take that out, but I'm not going to because everybody's receiving the same study guide. I'll clean that up for next time. Right? So case managers / nurses must strive to reduce risks, practice wisely within your scope of care, and limit the opportunity for mistakes to happen. So the responsibility of the federal public health agencies, so that would be your CDC, includes surveying our nation's health status, what our needs are, what our practices need to be, setting the standards. And then they put those out to the state. And then the state public health agencies are responsible for implementing those federal needs and policies and procedures and standards of practice. Right? Remember, this section is government, the law, and policy activism. So it is the response. I mean, who has directed us through this COVID pandemic? CDC, right? And the states have followed CDC guidelines. And the localities in each state have followed their state's public health department, right? And then Healthy People 2020, this is important to know. 2020, or Healthy People 2000 became a national effort to improve Americans' health over 20 years. Okay, well, we're well beyond that now. We're now at 2030. The first goals were just basic and focused on increasing the years of lives, reducing health disparities, improving access to services. But then they compare it to Healthy People 2020. Okay, so this bullet is about how the goals have developed over 20 years. We used to just worry about or focus on increasing years of life, reducing health disparities, improving access to preventable services. Now in 2020 and 2030, so they have expanded those original goals, right? They're now more specifically focused on more descriptive outcomes. Okay, so the goal in 2000 to increase years of life, reducing health disparities, improving access to preventable services has now turned into, that same goal is now attaining a high quality life, living longer, free of preventable diseases. Does that make sense? So that bullet is focused on how the general goals of 2000 have shifted to be more descriptive, more detailed in 2020, 2030. Okay. You need to know about the World Health Organization. What's their primary goal? Attain the highest possible health for everybody. Okay, and here's what they do. You may get a question about what kind of services does the World Health Organization provide? Well, monitoring drug reactions is one. Establishing standards for vaccinations is two. Disseminating biomedical research. Three, providing information on internationally occurring diseases. And then fostering the collaboration for public health initiatives through countries. So if you get a question about World Health Organization, that's really the only international health organization we talk about in this class. So know what their services are. And then this last bullet is several different agencies. Just have an idea of what the agency is and what they're responsible for. So for example, an agency for healthcare quality research and quality is focused on improving quality and safety for healthcare. Know what does the CDC do? Responsible for monitoring health, detecting problems, implementing preventive strategies. Then we have the Health Resources and Service Administration, and the NIH, the National Institutes of Health. So that's more definitions, but you need to know those four and what each of them do. Okay, then case management. Are you getting how we're breaking all this down? Okay. So you have a case management section. Go through and find the important part of the bullet and then read the rest of it. Don't just read the first sentence, right? This one starts out with a case manager is responsible for promoting self-determination when advocating for a client. Okay, so what does that mean? What does all that mean? What's promoting self-determination in clients?
Encouraging the patient to move, to do better, to exercise, to
yeah, taking control of their own life if they can. Okay. Nurse case managers work to meet health and well-being of clients through coordination of care. That's the definition of your case manager. They are the coordinator of care. Many, many nurses have case manager roles, right? They work with PT, OT, dietitians. They do discharge planning. What services is the client going to need when they get home or get to the rehab? Okay, the next section is violence and human abuse. Again, go through these sections, look at these bullets. Okay. This, what's in the violence and human abuse section is some ideas of what school, in this particular section, what some ideas that communities have used with families to try and decrease or prevent the violence. So a primary prevention strategy with the community approach that incorporates strategies from criminal justice, education, social services, community advocacy, public health to prevent violence. Some communities have used the following. So here's 5 good examples that communities have done to try and reduce or prevent violence. Infectious disease prevention and control. Okay. Here we're talking about vaccines, STDs, TB. When we're working with families, we need to make sure that they know that vaccines are the most effective method of preventing and controlling communicable diseases. I worked in the schools for 20 years. There's families that don't want to get their kids vaccinated. That's fine, right? All we can do at that point is try and educate them. that vaccines are truly the most effective method of preventing and controlling communicable diseases. And then this goes through vaccines. Who are the high-risk populations for not getting vaccinated? Why are they not vaccinated? Okay, we have no shots, no school, federal law in this country, right? But families can do exemptions, religious exemptions, medical exemptions, personal exemptions. So there are a couple of questions in the exam about vaccines. Not the timetable of when they're due and all that. It's more about who do we need to watch out for? Who are the vulnerable populations that may be less likely to be vaccinated? And this paragraph goes through this. Okay. Here's some information to review on sexually transmitted diseases. This basically talks about, is it bacterial, is it viral? If it's bacterial, it can be treated. If it's viral, it can't. There's no cure, right? Symptom management. I do want to mention syphilis. Even though syphilis is bacterial, if it's untreated, it's considered high risk for transferring from the mom to the fetus, right? Oops. Surveillance and outbreak. You need to know the difference between observation and surveillance. This talks about it right here. The purpose of observation is to assess public health status, identify trends of a disease, set priorities, use your resources, and develop a plan for rapid response. Does that sound like your ADPI? That's your ADPI. And then what's the purpose of surveillance? Reduce morbidity and mortality by preventing the control of the spread and controlling the spread. So know the difference between observation and surveillance. You may be given a scenario that says, is this an example of observation or surveillance? Okay, few things we need to know. You need to know about surveillance systems. That's this paragraph. Okay, there's several systems. These next three bullets are all definitions. Surveillance systems, patterns of occurrence. Okay, so you have up here, your surveillance system, you have a passive, you have an active, you have a sentinel, and you have a syndromic system. So you need to have just an idea that there are four systems and what they are, right? So passive surveillance is us working in healthcare, reporting cases to the health department, doctor's office, hospital, reporting cases to the health department. Then once it becomes active, the health department then has to seek out if there are any other cases, say food poisoning. Right? So say a hospital reports 5 people coming in, ate the same restaurant, they're all sick. It has to be reported to the health department. Then the health department in an active system starts to search for any other cases. Maybe contacting other hospitals if you had any people show up in your ER with this. Okay, and then there's a sentinel and syndromic. Patterns of recurrence. How did it happen? Several. There's a point source outbreak, which is essentially we're all on a train together and there's some kind of chemical exposure. We all get sick together. And then an intermittent outbreak. That would be like a food poisoning over a day or so. We all will get sick at different times. Okay. And then it's called a mixed outbreak. That's another pattern of occurrence. And a propagated. Okay, so please know these definitions. Then the last thing about surveillance is when developing community-based programs, the nurse first has to do a needs assessment. There are a few stages to that. There's a preactive stage, a reactive stage, an inactive stage, and an interactive stage. And all these 3 paragraphs give you a sentence in describing what each of these are. So there's my highlighted words so first, your 4 surveillance systems, your 4 patterns of occurrence, and your 4 stages when conducting a needs assessment. Okay, so I'm trying to show you how to break it down so it just doesn't look like a whole bunch of reading. There's specific information in each of these. Then there's a couple of models to use for planning. One is the patch model. Focuses on mobilizing the community to act, collecting data, choosing health priorities. Then the second model is your assessment protocol for excellence in public health. That focuses on setting priorities. And then there's your MAP, mobilizing for act through planning. It's called MAPP, MAP. Whoops. And their focus is on long-term planning. Okay. So a lot of information in surveillance, but if you focus on these words that I've highlighted, hopefully it helps break it down. I think managing safety and quality, same thing. What's the difference between continuous quality improvement and quality assurance? That's what we need to know. Okay, there's a difference. Think about it, quality improvement. We're always working to improve and be better. We send out surveys to patients. You get surveys, you get phone calls. How do we do? Process improvement. Okay, where quality assurance is detecting errors, fixing things. So maybe a patient dies unexpectedly in the OR. Well, the quality assurance people are certainly going to be looking into that. What happened? What happened? How can we do better? And they're the ones that do an investigation. We're trying to ensure quality. Patients expect to come into the hospital and go home. All right. Tracer method. Tracer method is how do we look at outcomes? Okay, there's one thing, the tracer if you're participating in a tracer method program in which they're trying to measure outcomes. If you are participating, here's what needs to happen. You have to have the same disease, same stage of illness, similar lifestyle, similar intervention, and live in the same community. Okay, so that's continuous quality improvement. That's part of a continuous quality improvement program. Right, so if a hospital's looking at some outcomes of patients that have had a triple bypass, and they want to look at outcomes, they have to make sure that in their control group, all of these are present. They had the same surgery. They're approximately at 1 month of whatever, recovery, similar lifestyles, similar interventions, live in the same community. Okay. Okay, I'm going to let you tackle the rest of this study guide. There's only a few more sections, but I'm going to let you tackle the rest of this. But I wanted to give you a general idea of how to tackle it, how to break it down. It's long, it's a lot of reading, but you can break it down just like you break down your chapters. You don't read the chapter from start to finish. You look at your objectives and then go start looking, go start reading. Make sense? Does that help? I mean, test taking strategies. What do you guys do? What do you guys do? Nobody changes their answers, right? Good. Nobody changes their answers. Good. That's a good thing. If you are going to change your answer, you better make darn sure you have a good reason to change it. Not, oh, I think she said that. Or I remember reading about that. I remember hearing about that. One of my teammates told me that. No. Only read the question a couple of times. If you really have no clue, just make an educated guess and move on. Don't spend a lot of time on one question. It's only one question. Keep going. I always suggest that read the question, then try and come up with an answer in your head first without looking at the answers. Come up with an answer first. What do you think it should be? And look at your answers. Is your answer there? Then that's your answer. Okay. What else? I don't have my paper in front of me. Take your time. Don't rush through it. Take your time, read the questions, write down cues in the questions, important words, important phrases, important information. That's where I find most of the students, their errors or the incorrect questions when I do reviews with them is they miss something in the question. If you come upon a question that all the answers look good, but you can only select one, you probably missed something in the question. Like what's the first? Or what's the priority? Or what's the most important? And don't be afraid to select all and select all that apply questions. There's no rule of thumb that says it's only one or there's no way it can be all. Sure it can. Don't be afraid to select all that apply. What else? Anybody have any tips? Use your highlighter. Use your highlighter. Highlight words, important words, or write them down on the whiteboard. Use your line to draw through answers you know are not correct. Rule them out. Okay. Helpful? That's how you tackle the study guide. You got to break it down into different chunks. Okay. Questions, feedback. Okay. Well, thanks you guys for coming. Did everybody put their name in the chat? So I'm going to send, you'll get this recording. All your professors will get this recording. And then good luck on your exam next week. We're getting close. Thanks. I appreciate you coming. It means a lot that you are motivated to get in here and figure it out. So that's good. I'm happy for you guys.
Thank you.
Thank
You're
you.
welcome. You're welcome.